Welcome back, class. We're going to talk a few minutes now about ICD-10 codes. And remember, ICD-10, when we talk about these types of code sets, they tell you why the provider did what they did and why the provider used what they did. So let's say you present yourself with a broken leg. There's an ICD-10 code for that broken leg. You go into the doctor's office in the morning, you're not feeling well, you think you may have the flu. There's an ICD-10 for the flu. There's an ICD-10 for pneumonia. There's an ICD-10 for every type of rationale that you would go to see or go to seek healthcare goods and services for. And one of the reasons that ICD-10 was implemented is healthcare reimbursement is contingent on accurate coding. Remember, accurate coding, not the first time we've heard them talk about reimbursement, but it's reimbursement and accurate coding. And ICD-10 stands for International Classification of Disease, ICD, the 10, so it's ICD, capital ICD hyphen 10. 10 is the 10th, version of it, for lack of a better term. And ICD-10, the 10th version, or the 10th revision, let's call it, was implemented in 2015. Now we're into ICD-11, and it was implemented in 2022. But it's a person's condition and diagnosis. Again, it tells you why an individual sought healthcare goods and services. World Health Organization needed a medical coding system for labeling disease, and this was in 1948. The WHO creates the codes, but the CDC, Center for Disease Control and Prevention, allows government agencies to modify the codes. So you can take, even though the WHO, World Health Organization, creates the codes, the CDC is allowed to adjust those codes to work here in the United States. ICD coding format, it contains 3 to 7 characters. Capital, so it's got a capital letter, and then it's got a number, single digits beginning with 0. The letter or digit followed by a decimal, and the letters and numbers. So it is a 3 to 7 character code. And as we move into these examples of claims that we're going to see in module 5 and 6, we'll be looking at some of these types of ICD 10, and actually now I guess it is ICD-11 codes. And what the ICD codes provide, it provides the name and it describes the disease, describes comorbidity. Is it flu or is it pneumonia? Where it's affected. Let's say you're going and they think you have a tumor. It's going to tell the location of that tumor. Severity on a tumor. Is it malignant or benign? Causes, on purpose or unintentional. And where it gets really interesting, especially on the causes, it's on purpose or unintentional, especially you run into some really weird types of episodes when it comes to insurance and workers' comp and motor vehicle accidents and things like that. So, and also they're concerned with, from a cause, was it self-inflicted? The ICD-10 or the ICD-11 CM, the CM stands for clinical modification at all healthcare facilities. So remember on the HCPCS, there was a level 1 and level 2. Level 1 was CPT code, level 2 with HCPCS codes. If you're talking about ICD type codes, the diagnosis, you've got the clinical modifications, which describes the disease, and you've also got the procedure coding system, and it's for the procedures in the hospital only. So you go into the hospital for an appendectomy, and the ICD, the CM part of that diagnosis code is going to describe the clinical modification, which is going to be appendectomy. There will also be an ICD PCS or procedure coding system that's also going to be on the claim, and it's going to describe the surgical procedure that was provided in the hospital. And these surgery, when it says hospital only, it can be outpatient surgery in a hospital suite. It can be in the OR, the operating room. But remember, on the HCPCS, there was level 1, level 2, and now on the ICD type codes, there is a CM, which is the clinical modification, and the PCS, which describes the surgical procedures. When it comes for uses of ICD-10, creating and tracking patient treatment plans. Again, information, labeling death certificates. You have to have an ICD code on the death certificate. Monitoring patient safety. That's where we're talking about, what's it, a hospital-acquired condition? Did the individual, as they're transporting them from the emergency room to their acute care room or their med-surg room, did they fall off the gurney and break their arm? So those are monitoring, when they talk about monitoring patient safety. They're used for medical billing, insurance reimbursement, and collections. They collect data for public health monitoring. They do, data there for healthcare research. Correlation between less common diseases and more well-known conditions. And again, once you get out, if you go into the healthcare arena, no matter which side of that financial coin you're working, you're going to have access to all of this information. My nurses that I had in Buffalo wanted the textbooks. They wanted the books. They wanted a CPT code book. They wanted a HCPCS code book. They wanted a ICD-9 book. They wanted a DRG book. They wanted those books that they could hold and work with. The individuals on my team that were the analysts, they wanted everything on the internet. They wanted everything electronic. So depending on where you work, you're either going to have a library where you can access the books, or you can have the information electronically where you can key in and it's going to bring the information up. One of the things that I always tell my students is don't try to memorize. Don't spend all your time trying to memorize this information. That's why they make books. And that was information that was provided me as an undergraduate. And my major professor, we were discussing something, and I said, this stuff it's confusing. It makes it hard to memorize. And he looked at me and said, don't ever memorize this. Of course, he said, crap. He said, don't ever memorize this stuff. He said, that's why they make books. Understand the basics. Understand not only how the basics work, but how they fit into the job you're going to have. And then all you have to worry about then is just knowing where to go to find the information that you specifically need. So that's what I want you to understand. I'm trying to provide you the basics. When you get out into, again, if you're going to the healthcare arena, you're going to have access to all of this stuff, either in some type of paper form that you can grab and hold on to, or you're going to have it on an electronic version. ICD-10s are used in the general public for tracking healthcare expenses, preventing fraud, overcharges within the medical billing society, communicating with billing and insurance companies, and understanding personal diagnosis and health conditions. And again, you will see diagnosis, it's going to be a capital D with a subscript little x, or if it's plural, it's little d, little xs. So one diagnosis or multiple diagnosis. And again, I managed or directed the activity of payment integrity at Blue Cross Blue Shield. And one of the components of payment integrity were fraud, waste, and abuse. And we had special training sessions for our members if they were interested in learning what we did and fraud, waste, and abuse. And it got to the point that a lot of the calls regarding fraudulent billing by providers were generated by members. They increased their human capital enough that they could read their explanation of benefits, and they would see either diagnosis codes or CPT, HCPC codes on the bill, and they would call in, either talk to us directly, or we had a hotline, 1-800 hotline, and they would, leave name and, phone number to call them back. But a lot of our fraud cases originated because individuals were concerned about what they were being billed for and how much they were being billed for, and they were rattling our phone lines constantly trying to figure out were they being fraudulently billed by the provider that they were going to see. The ICD diagnosis codes are most well known in the world of insurance and public health, public policy. Keeps track of charges during a transaction and mitigates fraud. Talking about fraud again. A key driver for hospital reimbursement, especially in a DRG-based world. And we'll get into that a little later on. But one thing that I will kind of throw out there now is most hospital contracts, when it refers to the inpatient side of the house on that contract, you're either paid DRG, hospitals paid bill charge, may be paid on a case rate basis, or it may be per diem. And when I say per diem, you will have a reimbursement section in that contract that says, for this type of hospital room, we'll pay X number of dollars. So it may be a med-surg room and they'll pay $800. If it's an ICU room, they may pay $2,000. And they'll have each of those room types listed in the contract with a dollar amount listed with each of those room types. ICD codes are used for public health because it's an efficient approach to collect and analyze healthcare data for large populations. When they talk about big data in healthcare, it is truly big data in healthcare because there are millions and millions of observations of healthcare information that if you're working on the public health, public policy side of the house, you're going to have access to. It's an efficient way to track diseases and develop roadmaps to other related conditions. Diagnosis criteria is based on collections of data, information on where disease and intervention is needed, and data on social conditions or events that encourage a particular disease. And especially over the last few years, there's been a lot of activity in public health and public policy looking at that social factor, that social interaction that may be eroding our health status in the United States. And now the concern is with all the migrants coming up over the southern border, not only what's that going to do to the healthcare infrastructure and the resources that are in that infrastructure to provide goods and services, but what's it going to do to impact the health status of those of us, especially, that have been trying to monitor and trying to manage their healthcare status over these years. Let's see, is there anything else? And I think that's all we're going to talk about, at least at this time, about ICD-10. When we come back, I'm going to spend just a few minutes talking about modifiers, and that's going to take us back to the HCPC and the CPT codes. Talk to everybody in a few minutes.